Welcome to Eye to Eye. I'm Camiel Boon. Today I'm talking to Professor Francesco Bandello about the state of diabetic retinopathy today.
Good morning.
Diabetic retinopathy is now considered to be a major global health problem that is growing at an alarming rate. What do we have to do to meet this challenge, you think?
I think we are living a very important phase, historical phase, because technology is giving us the opportunity to have a lot of new devices useful for diagnosis, very early diagnosis of diabetic retinopathy. And we have also a number of therapeutic options for our patients. And this is happening on the same time that we know that diabetes is exploding all over in the world. So we need really to be able to organize ourselves, our services, our systems, in order to use at the best possible level these new devices and these new compounds in order to guarantee to our patients a very good prognosis for their disease.
We have many new tools for imaging the diabetic retina, such as OCT angiography. How has this changed your workup when you see a diabetic retinopathy patient?
I think that at the moment, OCT angiography did not modify significantly clinical practice. The number of fluorescein angiography was really reduced by the advent of OCT and partially of angio-OCT. But I think that at the moment we still need a good clinical evaluation of our patients, eventually associated with fluorescein angiography, and angio-OCT at the moment is still not able to guarantee all the information we need for at best management for our patients.
So we shouldn't throw away our angiography machines yet?
Not at the moment. Maybe in future, wherever OCT angiography will be able to guarantee ultra-wide field image like we have today with fluorescein angiography, maybe yes, this will change the reality. Although I think that the leakage, which is one of the typical features of fluorescein angiography, will be always useful to us in order to understand what is going on with blood-retinal barrier breakdown. Angio-OCT is the best method to evaluate capillary dropout. But the other face of the coin of diabetic retinopathy, which is blood-retinal barrier breakdown, is not seen well by angio-OCT, and you need OCT for evaluating at least the thickness of the retina in order to understand how much blood-retinal barrier is altered.
Point taken, yes. We also have an ever-increasing array of drug treatment options. And what do you think among these drug treatment options are the most exciting in this area?
They are absolutely important today, and we lived a revolution with the association of introduction of OCT, introduction of intravitreal therapies. Now, this historical moment, we had these two new things happening together on the same time, made a difference. And today we manage our patients in a completely different way. And this is thanks to these new things. For sure, what we need is a very long-lasting therapy. This, at the moment, is not available. We are starting to have something like that with steroids, Iluvien, for example, which is a new steroid able to stay for a long time inside the eye, can be a step forward in this direction. But at the moment, we are still, we need still an anti-VEGF long-lasting inside the eye. We don't have it. And we know very well that the modality of action of anti-VEGF is wrong, considered on the same time of the pathogenic mechanism. Diabetic retinopathy is chronic. You have this high level of cytokines inside the eye, and we are using some bump inside the eye. They are able to reduce the cytokines for a short time, and then cytokines start again to increase inside the eye, and this is completely different from what we need. We should need something which is able to stabilize the situation for a long time in a way which is, coherent with the pathogenic mechanism of the lesions.
Do you think that's feasible in the next few years? Do you see some interesting compounds coming up, or does it take some time?
I think that with time we will have it. I'm sure about that. We had this revolution in few years, and I have no problem to imagine that we will have something which is able to act for a long time. the other point to be considered is that probably we will have some systemic drug to be used very early
Yes.
during the disease in order to avoid diabetic retinopathy as well as nephropathy and the other.
Even better, yes.
Yes, I think this will be the future.
Okay, thank you. Thank you for joining us. For more information on this and related topics, please visit us at euretina.org.